I'm Latia, and today we are going to complete our FOMO series with the RinKit XCP. I have Axel here, my mannequin. He's already got his lead vest, and I've got my barrier on my tube head with a sticker on our outside main panel. So we're going to start with our anterior periapical films. The more anterior we start in the mouth, the less likely we are to cause the gag reflex on the patient. With our PAs, we want to see the whole tooth and a little bit of bone up the top. So we need to make sure that we're remembering to visualize that with. Okay, I've got my blue bite block on my Rin XCP sensor holder, and I'm going to start with my anterior lateral canine. So I'm looking to open up the contact between the lateral and the canine. So I'm going to center those two teeth on the bite block here and just have the patient close up, making sure that our cord is outside. And we're going to line the PID up with the RinKit. Next, we're going to look at the centrals. So I'm going to shift the sensor over, and we're going to look at exposing the 1-1-2-1 centrals. And again, I'm just aligning my PID up to the RinKit. I'm going to repeat on the left side, making sure the cord is outside the PID. After we complete the maxillary arch, we're going to move to the mandibular. This can be a little bit trickier because the teeth are smaller. If we have any mandibular tori, you're just going to want to move the sensor past the tori so that it's more comfortable for the patient. Again, we're looking at a lateral canine on the right-hand side first. The patient's chin can tilt slightly up for this exposure, just to make it more comfortable position for the tube head. And we'll repeat across the arch. Next, we're going to work to expose the posterior PAs, and we're going to use this with the yellow bite block. The anatomy that we're looking for is similar to the bite wing, so we're going to expose the premolars first and then the molars, targeting the distal of the canine for the premolar and the distal of the 5 for the molar. I'm going to start on my maxillary right-hand side, exposing my premolar first. I'm going to enter the mouth at an angle with my RinKit and rotate onto the arch, centering the premolars on the bite stick and having my patient close. For the molar, we're just shifting the RinKit backwards slightly, opening up the contact of the 6 and the 7 and having that patient bite down again. Lining up the PID. Okay. A trick, because these are quadrant specific, is we're going to move from the max right to the mandibular left. This way we don't have to move around our RinKit. Again, we're going to expose the premolar and the molar, and then we're going to do the same on the opposing sides. Rotating in. If we had mandibular tori, we would just move the sensor past the tori so that it's more comfortable for the patient. Now I'm going to flip around my RIN kit so that it's ready for the other quadrants. And there you have it. We've finished our FOMO series. It's important to remember that you can use a RIN kit, but if this is not accessible, you can also use a bisecting angle technique with a snap ray, which we'll learn about later.